Why are people drinking to the point where they're dying?
I think what we've seen is a really significant rise in consumption of alcohol since COVID. We know that a third of people who were drinking alcohol during COVID increased their drinking from already quite high levels. And unfortunately, what's happened there is that you see an increase in the risks to their health, which includes death, unfortunately. So since the pandemic, 3 or 4 years ago, we've seen this really significant rise in deaths year on year since that point.
Do you know, I'm going to talk about a friend of mine that I've got at the moment, and you're absolutely right regarding lockdown, and this report is absolutely right regarding lockdown. And what they are is a functioning alcoholic. They start drinking early in the morning, and they sort of just drink all day and function. They're absolutely fine. They're completely and utterly fine, but they are just drinking all day. And I wonder whether, is that what we are seeing, that suddenly we have perhaps an epidemic in this country of functioning alcoholics that are able to live their lives until the day they're not?
Absolutely. The classic image of someone who's maybe rough sleeping or homeless and has an alcohol problem is distorting really the reality. And I'd agree with you. I think what we're seeing is people that are actually functioning quite well, probably, holding a job, in a relationship. So against all the stereotypes that we hold, but unfortunately have a real dependency on alcohol to the point where it's actually risking their health, and ultimately they're paying the price with their life, unfortunately.
Because weirdly, I think that, correct me if I'm wrong, you may know better than I, but weirdly, I think that we're not seeing as many people, young people, binge drinking like they used to. This image that everyone's going out every single weekend. Younger people are actually drinking less. What I think has shifted, and perhaps this has happened since 2019, perhaps this has happened since the pandemic, is people drinking at home, people just drinking more leisurely, and rather than, and I wonder as well if the demise of the pub and the demise of younger people wanting to go out so much, you would think that would be making people drink less. But actually, when you're in a pub and when you're drinking out and about, it's a controlled environment, isn't it?
Absolutely. And, the price of alcohol relative to income has come down year on year. And of course, what that creates is, easier access to alcohol. You walk into any supermarket and you see all these bog off offers, of buy one, get one free, etc. So I'd absolutely agree with you. I think, drinking at home has become a far greater phenomenon than drinking in the pub. So yes, we've certainly got the ideal constellation of price and availability, which is accelerating for some people the consumption of alcohol, which of course is creating this really disastrous results in deaths and people dying before they're due to die. Really, the number of fatalities that we see of people in their 50s and 60s dying well before they should, which is really shocking.
However, and it sounds like you might agree with them, the Alcohol Health Alliance UK says alcohol consumption could be reduced if there was a minimum price for each unit of alcohol. I disagree with that personally, but where do you stand?
Well, I think it has a place to pay. I think the experiment that's happened in Scotland, where they've introduced minimum unit pricing rather, has produced really good results. I think it's difficult for any one policy to be the answer to this. I think it's a constellation of interventions that will help with this. So I'm not sure that minimum unit pricing will be the complete answer to reducing deaths in England, but it certainly could play a part.
Has it played a significant part in the reduction of alcohol consumption in Scotland?
Absolutely. Without a doubt, it has reduced or certainly stabilise the number of fatalities due to alcohol that Scotland has experienced. And Scotland had one of...
So the numbers of people who are dying in Scotland has actually, I mean, you say it's stabilised, so it's not increased. It hasn't gone down, but it's not increased as a result of since they brought in the alcohol minimum pricing.
Absolutely. So it's not increased. We've seen a flat line in that, which I think we can directly correlate to minimum unit pricing. That said, I think people who are dependent on alcohol will still find a way of, funding their alcohol use, and they may miss out on other things such as their,
dinner,
buying food, etc.
Yeah, I am completely from that school of thought. I've had my moments with alcohol in the past without a shadow of a doubt, and I don't anymore. I drink in moderation now, and I really enjoy it. And I do. I've learned to enjoy it rather than throw it back till I fall over. And there was nothing that would stop me. There was no amount of price that would have stopped me buying it if I'd wanted it. And I genuinely believe that you can put this to absolutely everything. You can make this the same with food. If you are going to absolutely gorge yourself, I don't think adding a bit of money to the food will stop you doing that. I'm firmly of the belief that actually who it penalises is those people who are on low incomes who want to drink moderately, who then find that they are priced out of doing so because of the fact that you're putting the price up for everyone. So I'm not sure that is a policy that I agree with.
I'd go along with that to some extent. I think, as I say, on its own, it's not going to solve the problem. I think there's a number of things that need to happen, but at the very least, what we should see in England is some kind of public health focus and intervention around this. It's really urgent.
So how so? What should the government be doing? What kind of intervention should they be carrying out?
Well, I think at the very least some education around alcohol, understanding that alcohol is a major risk for cancer, as well as liver disease, etc. So we've seen very little from this current Labour government around alcohol and having any kind of strategy to deal with it. So I think that at the very least is something they could do. It's not expensive. It's not something that's going to cost a lot. So I think it's something you could do relatively easily and relatively cheaply as well.
All right, listen, good to talk to you.